So for starters, a lot of times you think about an employer and a broker consultant sort of doing it on their own, right? Just a two-person team. But when you join a captive, you've got other teammates. So you've got the rest of the employers that are in that captive. You're going to meet them at a workshop and or a board meeting. We've got internal resources, of course, that will help them understand the ecosystem of all of the different cost controls and vendor solutions that exist. So it's not just doing it alone, and that's not to take away from the really good brokers and consultants out there. It's just, hey, if we're a team of two, why not be a team of 4 or 5?
Hi, and welcome to the Captivating Health Insights podcast. Today, we're talking about our mini-series in captive education, and we're kicking off our first episode with talking about moving from fully insured to self-funded. I'm excited to welcome back Dave Gillis, who is the Managing Director of Business Development here at Captive Resources. Welcome back, Dave.
Thank you.
Congratulations on being the very first returning guest to the podcast.
Huge honor.
Yes.
Happy to be here, and thanks for having me again.
Of course. Well, let's jump right into it. What do employers that are considering going to self-funding, so they're fully insured right now, what's the first thing that they need to think about when they're thinking about making that jump?
First thing they need to think about is how to set up those foundational pieces, right? So in my mind, there's TPA, network, which those two things are tethered together, and there's PBM. So the third-party administrator, right, they're processing all of the claims. The network is going to be what the employees have access to in terms of providers out there in the marketplace. A lot of times, employers are picking TPA based off of network. So if they want access to one of the large national networks, some of those large national networks are rented out, so they might have choice between an independent PBA or a TPA or going direct to one of the big insurance companies from a administrative services only or ASO perspective.
Okay.
We're big acronym.
We are. We over-acronym way too much, but
figure
that's okay.
If somebody's going to hear ASO, we can define that for them.
Yeah, please do.
And then, of course, the PBM, Pharmacy Benefit Manager, that's an important piece, especially for a group moving from fully insured to self-funded.
Okay. Now, that's helpful to kind of lay the groundwork for this conversation. And for those fully insured employers still, what is usually missing in terms of access, strategy, et cetera, that they're not getting?
Coming from fully insured?
Or, being from fully insured, or, coming from fully insured today.
Well, it's hard for me to think of strategy and fully insured in the same sentence.
Right. There's not really possible.
Yeah, I mean, there's definitely a place for fully insured out there, but it's more of a product, in my opinion. But when you move self-funded, it's much more strategic. You can actually do things with your health plan versus purchasing a canned product off of a shelf.
And why do employers stay fully insured? Are there some reasons that a group might stay there for even just for the year as they're trying or looking at being self-insured?
Yeah, so the first thing that comes to mind for me is size. Not every employer can really move into a self-funded arrangement. In our instance, when we start talking to employers about self-funding within a captive, it's really 50 enrolled employees with a soft floor. So those employers that are under 50 are sometimes stuck with a fully insured or a level funded arrangement. Sometimes employers aren't familiar with what options exist in the marketplace, or maybe somebody is telling them that they shouldn't be going self-funded.
Okay.
So I think it is important for employers to really educate themselves about what's out there and not just necessarily listen to the one or two people that they get advice from every year.
And what does that transition usually look like for the groups that are moving into a captive and a self-funded arrangement? What are kind of the key parts of that transition that they should know about?
I mean, pricing is really, really important, right? At the end of the day, they're making a financial decision about if this is going to make sense. So when they go get a stop loss or a captive proposal, right, the numbers need to line up. But then it's just really understanding, is this something that I'm willing to do? And health insurance is typically the second largest line item on an employer's P&L to payroll. So they should be willing to roll up their sleeves a little bit more if they're unhappy with current arrangement. And I think almost every employer out there probably doesn't love dealing with insurance.
Right. It's not something that people really usually have good experiences with or like to talk about, but it's so necessary, in today's healthcare environment most of the time.
And going back to what you said, lack of strategy. There's nothing strategic about getting a fully insured renewal. And, I always envision employers looking at it with one eye open, trying to see, is it a single digit renewal or is it like a 30% renewal increase? And, we've seen way more of the latter in the last renewal cycle just because the market is hardening, as they say, with a lot of large claims volatility and, a lot of carriers taking it on the chin.
What does that mean? We talk about like a hardening market or a tightening market. What does that exactly mean for people that may not be as familiar?
So high level, claims velocity is higher than normal. So with the most recent renewal cycle, we saw a higher prevalence of cancer claims, which, during COVID, they always talked about deferred care. And I think we're really starting to see that now. I think some of the provider contracts, the negotiations are a lot more tense than what they maybe were in the past with the networks or with the carriers. And it's in a lot of the new drugs that are coming out to market, right? The GLP-1s, the infusion therapies, some of these gene and cell therapies that are out there.
Yep.
It's all sort of a perfect storm that led to a hard market, which we haven't really seen a hard market. I've been in the space for about 15 years. I've never seen a true hard market. So it's tough, whether it's fully insured or self-funded. And, that's why we sometimes talk about captive being a softer landing place for employers, where you're in more of a controlled environment and you're coming together with other employers that, hey, we want to understand how all of this works. And then we're going to implement what's going to make the most sense for each of our own companies, and collectively that's going to help us all be in a better pool.
So when you say soft landing, you describe it going into a captive can be like a soft landing. What does that exactly mean? You shared a couple of examples, but what are some other practical examples? Like what does it actually look like for employers that make that jump into a captive?
So for starters, a lot of times you think about an employer and a broker consultant sort of doing it on their own, right? Just a two-person team. But when you join a captive, you've got other teammates. So you've got the rest of the employers that are in that captive. You're going to meet them at a workshop and or a board meeting. We've got internal resources, of course, that will help them understand the ecosystem of all of the different cost controls and vendor solutions that exist. So it's not just doing it alone, and that's not to take away from the really good brokers and consultants out there. It's just,
right.
Hey, if we're a team of two, why not be a team of 4 or 5?
Right. Yeah. You not only get the captive community, you get the resources that, we provide too as captive resources.
Yeah.
And what are the misconceptions out there? Because I have talked to employers where it seems scary, to make that jump. Like, what would you say are maybe some misconceptions to some of those barriers or the scariness of jumping in?
Yeah, I think the biggest misconception is that employers think, and again, I think this is misguided advice that they've gotten, is that self-funded is too risky. And, maybe 10 years ago in the traditional market, that might have been true with the lack of no new laser rate cap provisions, how reimbursements work with simultaneous reimbursements or advanced funding with reimbursements. But in my opinion, it's scary being fully insured because of the lack of transparency and the lack of control that you have. It's really the only way that you can sort of control things. And that would be the second misconception is people don't think, or employers don't think that they can actually control claims, which if you sort of dissect that, you can't control a claim, right? Heaven forbid somebody has cancer.
Right.
You can't control that, but you could potentially control how they source the drugs,
Right.
where they are seeking treatment. And all of those different things could be the difference between, there's one example that comes to mind right now that we're dealing with, could be $1.5 million over the course of a year or $350,000 over the course of a year, right? That's where you have more control, is you can try and help employees find the right care at the right price.
Because the claims are going to happen. You're going to have claims. We all need care. It's controlling, like you said, like where they source the drug, how they source the drug. Is it caught earlier? Is it caught later? And kind of controlling what you can control.
Yep. And for the HR professionals out there, like you're really helping your sickest employees. Like that's who you tend to help with is, yes, it's an ROI for the employer, but if you can help minimize some of those claims for the employees, like that makes a big difference too. And they start to really feel like they've got benefits.
Mm-hmm. Right. And you're supporting them oftentimes at their worst moments, their whatever it is, cancer diagnosis, major surgery, whatever it is, and you're there for them. And that is, going to be huge for morale and even getting them back to work as well if they have more support.
Yeah. And so when you move, just going back to fully insured to self-funded, you become the plan sponsor when you're self-funded versus if you're fully insured, the carrier is the plan sponsor. And when you're the plan sponsor, you have a little bit more say with how claims are treated.
Mm-hmm. Yeah. And going back to, you mentioned transparency before. So what do you see as kind of the biggest eye-opener when you see those employers that are just looking at their, very basic reporting when they're fully insured? And then what doors, like what real insights open in terms of transparency when they move to self-funded?
They get to see what things really cost, both on the medical side and on the pharmacy side.
Okay.
And I think sometimes they take the fully insured claims reporting, the little bit that they get, which I think of it as more of like a pacifier. Like, hey, this is just to pacify you and keep you from leaving, whether we're scaring you or, you're getting a small increase, like, oh, your claims are good, don't leave.
Showing some pie charts and some little graphs. Yeah.
Yeah, but they get to see what the true cost of things are. And it's much more detailed information. Some employers, when they first think about making the transition from fully insured, they're like, well, I don't want to see the data. And that's okay. Like the TPAs can de-identify some of this information.
Right.
It's all HIPAA compliant the way that they're looking at this information, but you can't manage what you can't measure. And so the only way to really be able to control a health plan is to be able to see all the claims.
Mm-hmm. Yeah, that makes sense. Their eyes are open to what things really cost. And then they have the opportunity to dig in and say, okay, where are we going to start impacting cost and really managing some of these claims now that we see what it's really costing us and not just, looking at summarized, graphs and data.
Right. Yep.
So speaking of really starting to be able to have insights into what's really going on, PBMs and pharmacy costs is usually that kind of low-hanging fruit where employers usually start, right? Because that's kind of the highest cost and the most opportunity for impact, right?
We think so. Yeah. So like Stelara, for example, you see a top 25 drug report for claims information, and Stelara might be up there. Mm-hmm. I think before the biosimilars came out, it was like $125,000 average annual cost for somebody that's taking that. With the biosimilars now, it's like $9,000 or $10,000 a year.
Yeah, just a fraction of the cost.
So which version of the formulary are we using? Are they still doing brand name Stelara? Or are they moving to a biosimilar? And then what are the rebates on those drugs too, right? So there's just there's a lot hiding in the weeds, and until you get real claims data, there's not a whole lot you can do.
Mm-hmm. Yeah, because you might know like the category of drug, but you don't know until you're self-insured, like the exact drugs and, how many doses are we talking? And again, we're not going to know who, or it's going to be de-identified. But now you can really zero in on a pharmacy strategy to impact those costs.
Yep. And that's typically where we start the conversations, right? We've got a great partnership with Navion that supports us with that. And almost always right off the top of whatever the drug spend is, rebates and or alternative sourcing options, like 20 to 25%. I don't want to say guaranteed, but
Right,
almost
but typically,
always like 20, 25% right off the top of whatever the pharmacy spend is.
Yep. Yeah, and we have some great episodes on, with Navion on controlling your pharmacy spend, but we had to talk about it here because that's just going to be a huge opportunity when you're moving to the self-insured model.
Yep.
And so how do you compare the costs? You said, obviously the pricing, it's a financial decision first and foremost. So when an employer is looking at going self-funded, how do they compare with, our team of business development executives? Like, what does that look like, that process of comparing?
So I think about when you move self-funded into a captive, we're basically just pulling all of the pieces of the puzzle apart and putting it back together. Right.
Okay.
So when a employer is fully insured, they've got administration, they've got the insurance, the actual insurance, they've got a pharmacy benefit manager, but it's just all baked in.
Kind of we do the bundled word probably.
Yeah.
It's all like one set program.
Yeah. So when we talk about like TPA, network, PBM, they have all of those things. It's just the fully insured carrier makes it look really, really simple and easy. But there's potential profit buried in there that the employer can extract out. So we just pull it all apart. We put it back to help them put it back together. But they're used to looking at things from like a max cost perspective, right? I pay a fixed monthly premium and I get a renewal every 12 months. Like, help me understand more apples to apples,
right,
how this compares from a max cost perspective. So we try to unravel that a little bit. Yes, knowing max cost is really, really important, but let's also look at what your expected cost is. And now when you're in a self-funded arrangement, especially a captive, you get to participate in the upside. Right? When you have those good years and you're maybe getting a single-digit renewal increase, that's where you're leaving the most money on the table. And that's where now you get to actually participate in that upside from a premium perspective and a claims payment perspective. So we like to model out, max, expected, good, and great, and show them what all of those look like. And typically at expected, there's some savings on the table, at least in the first year.
Okay.
Yeah.
So you model out like, hey, this is what it would look like if you had a bad year. Like, let's show you, like the worst. And this is, what it could look like. But good news, you're in a captive. So it's going to be, there's some risk sharing and it's not going to be, as bad as if you were on your own, on an island, not in a captive, just dealing with the claims. And then you also show, hey, if we had a great year, you're going to get rewarded for that. And then this is what it would look like in terms of dividends and things like that, right?
Yep.
You kind of modeled that out for them.
Yeah. And, the employer is getting weekly claims reporting. They're getting monthly captive reporting. So they know exactly how they're performing throughout the course of the year. So once it comes time for the renewal is one of the easier parts of the process because you know what's coming in a good year or a tougher year, and you can plan for that a lot better than you can if you're fully insured.
And how do you do that in terms of data? Because if you're fully insured, you don't have a lot of information. So how do you guys kind of model that out as much as possible?
I think the consulting community typically tries to identify what trend is. Mm-hmm. And then they will secondarily try to figure out, okay, are you performing better than what we're seeing in trend? Are you performing worse than that? But ultimately, it could be a surprise. A broker consultant might say, we're seeing 18% trend increases in the marketplace right now. So that's what we're going to, that's what you should budget for. But, 45, 60 days prior to the actual effective date, it could be something worse. It could be something better.
Because you don't know as much as you don't know what's going on. Like we said, that's the whole problem is that you just don't know. And so you kind of can take that first year to really figure out what is going on and kind of take your time and then setting up that strategy for year 2.
Yeah. Yeah. And just I feel like I mentioned it a little bit, but like putting in the right TPA network PBM strategy, that's a great year 1 approach. You don't need to put in a bunch of different cost containment solutions. Like let the data sort of drive what you should focus on in year 2 and year 3, like very much crawl, walk, run approach as you go self-funded. That's maybe a third misconception is like, going self-funded, there's going to be so much extra work with this. And that's really not what it should be. It should be, okay, we're going to put in these foundational pieces. And over time, we're going to try and identify some gaps and plug those gaps with the right cost containment solutions.
So you would say for those people that are worried about like, is this going to be so much more time and admin work? I don't have a team, to do this. Is that even realistic? You would say it is. It just looks different. Is that right?
Yeah. We get that question all the time. And I always think of it as you're rolling up your sleeves a little bit. You're not ripping your sleeves off. You're just rolling them up a little bit.
Okay.
It is going to be a little extra work, but it's as much work as you want to put into it. There's some employers out there that will spend maybe an extra hour a week on it, or there's some employers that they see in the first year, they save hundreds of thousands of dollars, and they're willing to go hire another person or two because they know that there's so much being left on the table it's worth an extra hire. And, if you save that much money in a year, like now you can afford it.
Right. Are you going to pay the insurance carrier more or spend a little money and get the cost under control and have better care for your employees in the meantime?
Exactly.
Yeah. Makes sense. Okay. So Dave, walk me through step by step. What does it look like for an employer looking at that stop loss proposal going into a captive arrangement so they can kind of see A to Z? What does that process look like? Yeah,
I feel like everything we're talking about is really fully insured to self-funded. But when it comes to incorporating the captive into the process, that adds one layer of complexity. Some people say it's confusing. It's not confusing. It's just a little bit more complex. So we think it's really important for our team to be involved to help educate the employers in terms of how this all works.
Your team meaning the business development executive that the broker would be working with?
Right.
Okay.
Yep. So broker, consultant will get us involved. And we really like to do education on the front end with the employer and the consultant, just before we get into the numbers, giving them a high-level understanding of how this works, right? This is stop loss with added transparency at the reinsurance level.
Okay.
So even more transparency than what you get when you're on a traditional self-funded chassis. So because of that added layer of complexity, we think it's important for employers to know what they're potentially getting into, right? Being self-funded is a long-term play. Being self-funded in a captive should be approached as even a little bit more of a long-term play.
And really quickly, sorry to interrupt you, but what is reinsurance just at its most basic level for those that are new to this?
So when you move self-funded, whether traditional or captive, the employer is going to choose a specific deductible that they are going to self-fund up to that limit, right? So if you've got 150 employee lives, you might take a $100,000 specific deductible. So for every belly button on your plan, so that's employees and their dependents that are on the plan, the employer is taking up to $100,000 of risk per person per year.
Okay.
So fully insured, 100% of what you spend is premium. When you move into this arrangement, it's typically about 15 to 20% now is what you're paying for premium. And what you're paying premium on is that reinsurance above the specific deductible, right? So when we talk about self-funding, you're really self-funding all of the claims below the specific deductible.
Mm-hmm. That's the employer's responsibility below that level.
Right.
Okay.
Right. But then, this is the scary part, right? An employer thinks, oh, well, if one of my employees has $1 million claim, I can't afford that. That could put me out of business. You're right. That's why you buy the reinsurance, to protect you from those catastrophic claims. So again, within the captive, you're going to get visibility into how the reinsurance is performing.
Gotcha. So that's that's why you're saying extra transparency. It's not only what's going on in your responsibility portion, but you're also getting then the extra layer insights into that too, and the claims hitting those layers.
Yep. So by definition, a group captive, you're becoming an owner of a reinsurance company. And we feel very strongly, if you're going to be part of a group captive and you're going to be an owner, you get to lift the hood. You get to see what's going on from a claims perspective.
Mm-hmm. Yep.
So because of those added pieces, we want to sit alongside the broker consultant and help educate their employer clients in terms of how this all works. And so ideally, we'd love to do that before we go through the quoting process, right? Then we get the data that we have access to. Some employers will say, hey, all we've got is the last 2 years of renewal increases. We don't have any claims data. That's okay.
Okay.
We've got programs that we support that can underwrite based off of that. And then we've got the financials. We want to re-educate the employer with the numbers to show them how it all works. And then once we go through, disclosure, firming the numbers with the consultant, then the employer, we feel like, is ready to actually make an educated decision. Is this the right time for me to do this?
Okay.
So ideally, that's over a 6-month process. I would say in many instances, it's a 3 to 4 month process.
Okay. And are you guys ever looking at the loss fund, and is that part of the analysis of looking at okay, this is, the premium you paid and the claims incurred? Is that sort of, because I get questions about hey, how does the loss fund work? And, how does that help me determine if I should be going self-funded now or wait, or does that come into play at all?
It does. We always talk about the potential for dividends for an employer. I think of dividends for a fully insured or even a level funded employer that's transitioning to this sort of platform. The dividends are great. Everybody wants to get a dividend back, but that's really the gravy.
Okay.
And the low-hanging fruit and the real opportunity for those employers is, how do we better manage our first dollar claims?
Okay, and have better renewals.
And have better renewals and just more stability within the health plan.
Gotcha. So those dividends that you get back when you perform well as a captive and even as an individual employer are just the gravy on top, the cherry on top, whatever condiment you want to use. It's more so we're better managing our claims, and we're going to see better renewals in general as a result.
Yeah, it's not uncommon for an employer the first year going into the captive that they might not get a dividend back, or maybe even get a little assessment, call it $50,000, but they save $200,000-$300,000 on the aggregate side or their claim spend side. Those are dollars that never leave their pocket. So net, they're way better off, and they're going to appreciate the renewal process if they perform that well.
Mm-hmm. And really quick, what's an assessment exactly? What does that mean?
So when you get into the captive layer, it's sort of binary. You're either getting a dividend or you're getting assessed.
Okay.
And there's different models within the captive layer. That's probably part of the series, so I don't want to steal too much thunder from.
This is a teaser, but the other episode, there's more to come, everybody. So this is a quick teaser. Yeah. Go on.
But there's that we think one size does not fit all. So we support multiple programs with different flavors depending on where groups are coming from and or how dividends can actually be generated.
Mm-hmm. Okay. No, that's really helpful. And as we kind of wrap up here, where do you see the captive market going in 5, 10 plus years? What should employers kind of be thinking about in terms of evolution?
So stop loss is poised to grow, I think, threefold in the next 10 years.
Really?
So the stop loss market represents about $40 billion today. And by 2034, it's projected to be $113 billion.
Wow.
So most of the largest companies in the country are already self-funded.
Right.
So there's not a huge growth opportunity there. It's really in the middle market where employers that are fed up with the hamster wheel of the traditional markets are really wanting to drive into these sort of solutions. And it's easier to go further down market because the premium increases have been so drastic.
Mm-hmm.
So call it the 50 to 500 space. That's where you're going to see most of that growth in the stop loss market over the next 10 years.
Gotcha. Those companies that maybe didn't think that they could become self-funded in the past and now realize they have this opportunity, especially through their captive arrangement, to really make that jump.
Yeah. So we're excited about where the market is going and really being able to provide true solutions to the mid-size employer market.
Yeah, no, that's great. Any other kind of closing thoughts you want to leave our audience with as we close out?
I would just say for employers out there, do research. You can go to ChatGPT and learn about just about anything in about 5 minutes.
Right.
Right. So if you're not happy with the advice that you're getting, there's a lot of other sources out there that you can lean on to try and find the right information. And I would say to the broker consulting community, just inquire about how our solutions work. There's a lot of different captives out there in the marketplace, and they're all a little bit different. But understanding how each of the different programs work will help set you apart in a market that is poised for this sort of growth.
Yeah. Yeah, no, it makes complete sense. There's so many different ways to structure a captive and just, understand what those differences are and, make sure you're educated as far as the solutions and what you can present to your clients. So love that. All right. Thanks, Dave, for being here once again and appreciate your insights today.
Thank you.